One of the important types of research being done in all of health and other subjects increasingly is the idea of evidence-based research, and evidence-based reviews are part of that. But people really struggle to understand what an evidence-based review is and how it's different from peer review research. To understand what evidence-based means, we have to think about what was happening before that and what still happens in a lot of cases. Treatment and management of health is typically based on tradition rather than scientific method, or it's somebody being suggested something that is coming from somebody who's poorly informed. An easy example is pharmaceutical reps whose only position is to promote the drugs their company creates. Not necessarily that these drugs are useful or appropriate for what they're being promoted for. So to counteract that idea, the medical industry has created this idea of what evidence-based medicine is. Evidence-based practice, or evidence-based medicine, in health we refer to it as evidence-based medicine, but many subjects refer to it as evidence-based practice because it has gone beyond the medical industry. It looks at the evidence to make decisions, and it typically involves three different parts. The best external evidence, and that is the evidence-based review, which we'll get more into, but also on what the clinical experts, the doctors, the nurses, know about what they're doing, and then what the patient values and expects. And this is truly what they want, not necessarily what somebody else wants. So the idea is to look at that evidence to make decisions, to look at all of this, and it's typically begun with the systematic reviews of the literature on a topic. The idea is that not all funded research is necessarily great research, so we review everything we can on a topic. The idea is to take it from various sources and then to apply what is learned and evaluate the results of that. Let's focus in on the evidence-based review, the first of three parts of the process to developing evidence-based medicine. This can't happen until after peer review articles have been written on a topic. Until recently, most evidence-based reviews were focused on treatment of issues. So it would look at how to treat a disease, how to treat an injury, or any other health issue that comes up. What does the evidence suggest? What we're moving into now, especially in health research, is personnel issues, professional development issues, policies on hospital procedures, and recommendations on how to deal with specific subsets of patients in different fields. What it does is it looks at all these peer review articles on a topic from multidisciplinary topics and databases, and it looks at the evidence of what they're saying actually works instead of what has always just been done on the past. An evidence-based review is rerun 5 years later to make sure that the most up-to-date information is included, and if any changes need to be made to the evidence conclusion, that they're done. So it's not going through a traditional peer review process, but it does get its review every 5 years to make sure the findings are still sound. You can find evidence-based reviews in research databases like CINAHL and Medline. At UMass Lowell, we have the Cochrane databases, which is entirely made up of full-text evidence-based review articles. And some of them can be long, hundreds of pages in many cases, at very least 100 pages. So there are different levels, and there's a tutorial on using Cochrane that you can watch on your own. But don't get frustrated if you don't find your topic. Not everything has gotten a peer review systematic review for an evidence-based review. There might be peer review articles about your topic, but they haven't transitioned into the evidence-based review. So there might be times where you have to think bigger picture rather than specific. And if you get frustrated, you can always come and talk to me. I'm more than happy to help you rethink the way you're searching for an evidence-based review specifically, so that it keeps in connection with what you're researching for your project.